the first annual fibromyalgia get-together that we're having here.
Oh, annual.
Annual. Yeah. I don't know. No. This is really a dream come true for me because when I had my fibromyalgia and I was getting all kinds of treatment and everything, and yet it seemed like I was going one step forward and two steps back. I mean, for everything I could try and manage, it seemed like something else would just keep cropping up. And my fibro was triggered by an auto accident. Can you hear me back there, John? Okay. Mine was triggered by an auto accident, and I had no cuts or bruises or injuries that I knew of. And then, just 6 weeks after the auto accident, I went to see my rheumatologist regarding another issue, which is my right arm. And here he said I had fibromyalgia. And so I was able to go and start getting treatment right away for my fibromyalgia, which was great. At least I knew what the heck was going on. My initial symptoms were I'd be very, very fatigued, just really wiped out, doing stuff I was normally doing. And then it was about 6 months later that I found out about the correlation between whiplash and fibromyalgia. So then, like I said, I was getting all sorts of really good, supportive, I mean, unlike a lot of people, I was really getting a lot of support in many ways. And, but then a year ago, the end of April, I came across Stop Fibro. And that's where my love affair with this guy started. Love at first sight on the internet. It made so much sense to me. And I thought, this guy knows me. And so what I did is I photocopied pages from the website, and I took them with me to my doctor. And this was May 17th. And my doctor, when I went to the office, I mean, I finally just crashed. I was just so low, and I had just so many symptoms and everything. And he said, Elaine, you need to go to the hospital now. And so that led to inpatient at Abbott Northwestern, and then I went to a partial program after that. At Abbott, after that, I went to Fairview University for a day treatment program. So, I mean, I was getting lots of help everywhere, but I was still always calling up to his office. Christy works in the office, and I'd be crying, and she'd be encouraging me, and things like that. And so I had told my doctor, I said, even if I can't go there and get treatment, we need to get treatment here. Because every time I was really down, I vowed to myself that when I got better, I would help other people. So anyway, he told me, well, Elaine, you need to go down there and get healed first. Then you work on trying to help others. So I went down there, and it worked. I would say that in the first treatment already, in the first visit, I went in to see Dr. Wickstrom, and I felt like I was 70 or 80 years old. I mean, I was so tired and worn out from the trip, and I was in tears. And he did an adjustment, and this was, I went down there December 19th, so it was right before Christmas, but I'd have to say the first thing to lift was the depression and anxiety, because I went through the holiday season and calling home and knowing I was separated from family and all this stuff for the holiday season, and yet I was okay with it. And so I would say the first thing that went was the anxiety and depression. And then more and more pain left, and I had more energy, and I was sleeping. I'm sleeping a lot, and made really good friends there, who I really miss now. Lake Tahoe was absolutely gorgeous, and so anyway, that's why I'm here, because I know what it's like to be able to live again. And for me, Dr. Wickham asked me, Elaine, what are you going to do when you get back? And I said, I don't know. And even in my video, if you go to my website, I said, I don't know what I'm going to be doing, but at least now I can start making plans. And so now this is what I'm doing. So I'm pretty excited about that.
I'm pretty excited too.
So anyway, I'm going to hand it over to Dr. Whitcomb, and after he's done, I'm just going to tell you about some little things going on afterwards to help you socialize and get to know each other and things like that. So right now, Dr. Whitcomb.
Thank you. This is an amazing woman. I mean, Elaine put this whole thing together. I mean, everything. We did very, very little at the office level at all. And she came home, and literally she says, we're having a seminar, and I'm putting it together, and so I said, well, then I'll show up. And so here we are. I'm so happy to be a part of someone's life who is so motivated and actually puts actions into the things they do. And she's just been a real joy to the office when she was there, and helped many people, encouraged many people. And as you can imagine, with fibromyalgia patients, you know, most of the time when people get there, they're afraid and they're scared, and maybe above all, they're afraid of having hope, because hope has been something that's been so elusive, and failed hope is one of the worst things a fibromyalgia patient can suffer. And so, needless to say, we do our best, you know, to get everybody well that we possibly can. When you think of a hero, what does that look like to you? You know, immediately some of us, we would say, well, a hero is Arnold, you know, or Bruce Willis, or you know, Kill Bill, or somebody. And so we will get maybe a big professional football player, or baseball player, or somebody in our mind who's a hero. And to me, I think oftentimes the people we set up as our role models and our heroes maybe are not really the heroes we're looking at all. I mean, these people are really not heroes. It's not to say they can't be a hero, because they're in a good place to be a hero if they will be a hero. But most of the time, they're just people who are paid very well for what they do, and the media system likes to promote them because it makes the media more money. So it's kind of like this, it perpetuates itself. And so I don't really so much think of these people as heroes, but if you, for instance, if we take a prisoner of war, and this person is taken against their will, imprisoned, looks like maybe they don't know, they look like they're in prison for life. They get tortured daily, they get sleep taken away from them, they're deprived, maybe they drug them, maybe they treat them so badly that it alters the systems of their bodies so that they really can't defend themselves well. You know, some of the torture techniques have to do with sleep deprivation and so much physical input and rejection. They found that one of the best ways to torture someone was to put them in a position where they feel rejected by others. And so would you consider a person who was subjected to this, maybe they were in a war or whatever, would you consider someone like this a hero? You know, I agree, this looks like a hero to me also, somebody who has suffered like that. But I would present to you that fibromyalgia patients are heroes. So let's think about it for a second. A fibromyalgia patient ends up sooner or later rejected by their friends. You know, they usually live pretty much alone, so they've suffered the rejection part of it. They oftentimes are rejected by their family members, sometimes their own spouses, sometimes their own children, and oftentimes by their own physicians. They will have drugs forced on them, you know, torture forced on them, loneliness and despair and hopelessness, and all of these things. And what did they do to deserve it? Absolutely nothing. I don't know of one fibromyalgia patient I can think of that actually deserved to get fibromyalgia because they did something wrong. So here we have a person, just a normal person, a mom usually, a wife, you know, maybe a child or a husband, and for no reason whatsoever, they're suffering in the same level that a person who is incarcerated in a POW camp somewhere. They're afraid for their life on a daily basis. You think I'm exaggerating? I'm not exaggerating at all. And you know I'm not exaggerating if you have fibromyalgia. 18% of the fibromyalgia patients, best stats we can get, actually accomplish suicide. That's almost 1 out of 5. Now, is that a severe disease? If you've got somebody, if you've got a group of people, what other group of people do you know? Cancer patients don't commit suicide at that level. MS patients don't commit suicide at that level. So you tell me what is worse disease, what is a worse disease than fibromyalgia? I just don't know. I know there's some really bad ones out there. I wouldn't want to have some of the other ones either. But I don't think there's a disease that hits you so hard that causes the level of despair and hopelessness and depression and loneliness and rejection that goes along with this disease, because many of the other diseases require automatically a total amount of support from other people. If you've got AIDS, you've got support. If you've got cancer, you've got support. If you have MS, you've got support. If you've got fibromyalgia, you're just crazy, whining, and you're pushed aside. And I'm telling you the truth. And then you guys laugh. And I'm glad you laughed and we can laugh about it. But it's really true, and you know I'm telling you the truth, because you look just a little crazy. You look a little tired. You look like maybe you should be referred to the psychiatrist. And we can laugh about it a little bit because it's kind of funny, but the reality of it is it's really not funny when you stand in the office, and I'll bet you almost every one of you has sat in an office somewhere and they said, you know, I really think you need to see a psychiatrist. And if your first thought is, they don't believe me. They think I'm making this up. Has anybody ever been told that? It's about everybody. And I think that impact, when I see that in my patients' eyes, when they tell me the stories and the tears come with it, they get this horrible feeling of, I'm not okay. And I know I'm not crazy. At least I don't want to be crazy. I'm just really hanging on to I'm not crazy. But the reality of it is, he thinks I'm crazy. And now they're going to send me to a psychologist. I have a lady that I've seen recently, and a lovely lady. She's had fibromyalgia for a long, long time. When she was 17 years old, she became severely depressed with her fibromyalgia. She became depressed, and so they took her to the doctors. The doctor referred her over to the psychiatrist. The psychiatrist institutionalized her. From there, they decided it would be a really good idea to put her through shock treatments. 17 years old, she's scared to death. She's incarcerated with people who are screaming and going through. She told me the story, so it was just horrible. But she went through this whole process, and she said after the second shock treatment, she says, I just put a smile on my face. I told them I was well, everything went great, and just waited until they let me out, because I was afraid they were going to keep me for the rest of my life in there. Yeah. And I could tell you stories of patients who have gone through chemotherapy for their fibromyalgia, had their ribs removed, breasts removed, or reduced, I should say, who've had multiple, one patient, 6 carpal tunnel surgeries, had nothing to do with it, low back surgeries, neck surgeries, exploratory surgeries, and many of you have already had these things, so I'm not telling you anything new. And this is the way that our fibromyalgia patients suffer. And finally, we're getting to a point now where it's coming out in the light. There's a lot of good research being done, and I'll give you a little bit of hint of something that's happening at our office. We're being joined by a psychiatrist. We're rewriting our book together, and he's going to be writing on the adrenal toxic syndrome, which goes along with fibromyalgia, some wonder information, and should be out in January. But he's been doing a lot of research in the same area as I have with fibromyalgia patients. He's been treating fibromyalgia patients for many, many years, and just a brilliant man. So we're tremendously excited about that. And he's been a real dear, close friend of mine for years also. So I think that fibromyalgia patients are heroes. Does anybody want to? We should all get. Yeah, you guys are heroes. And I think that every one of you, me including, I had it too, we should get an award, maybe a plaque, something. Maybe we should have a parade. I don't know. Maybe we should have a fibromyalgia parade. But we should do something. And we plan on doing some things. We're going to have to do something to raise the awareness of fibromyalgia and let people know that fibromyalgia is not a contagious disease. You're not crazy. It's a real thing, and explain what it is. And so that's why I'm doing these seminars. And I appreciate all of you coming out this early in the morning. My son and I flew in last night, Eric, and we just had it's exciting for me. I love doing this, and I appreciate it when you come up early. We're going to have another meeting this afternoon if you want to come back or invite some of your friends. Let's talk a little bit about fibromyalgia. And first of all, the name's a misnomer. Fibromyalgia is a real good name. It's a good name that got us started in the right direction. The guy that has been at the little 12, the 18 tender spots, great stuff, got everybody another step towards where we're going, and every single step. And what you're going to find is that I'm another step. I'm another step. And maybe the stuff we're doing is working great, but we're going to make another step and it's going to work better. And then there's going to be another step. And so it's in the progression right now, but it's in the public eye. There's a lot of research, a lot of things being done. We are now in the process, and hopefully next week we'll be finished opening a nonprofit organization called the International Fibromyalgia Foundation. And we have a whole group of grant writers we're interviewing and getting ready to make grant requests for people that don't have the money to come see us. And so we're going to be looking for money for research. We're looking for a new CT scanner and a number of other things in the office so we can do some real good research. We're working on creating radiological criteria for fibromyalgia. That's our next step, and that's one of the things we want to do, so that when you go to the doctor, you can just go run it up and go, oh yeah, you got fibromyalgia. It's going to change the world. The insurance companies are going to hate us for that one. That's what we're working on. Fibromyalgia is a misnomer, and the reason it's a misnomer, it's a good name in that it describes the fact that you have fibrous tissue. Myo is muscle, fibro is fibrous tissue, and algia is pain. You have fibrous tissue in the muscles causing pain, and that pain is caused by the fact that every time you move, it pulls on those little fibers, and it hurts, and then your muscles swell, and then you have a fibromyalgia flare-up. So you wonder why when you exercise you get a flare-up? That's exactly part of it. And we'll get into some of the other reasons in just a little bit. And so how do you get those little fibrous muscle tissues, little fibrous tissues out of your muscles? Keep muscle therapy. But when you have fibromyalgia, you already figured out when you get that, you have a huge flare-up afterward. Yeah. So we'll talk a little bit more about that also. I prefer upper cervical spinal stenosis. There's another wonderful doctor, and I'll go ahead and mention that on tape this morning. His name is Dr. Heffes. He's in Wisconsin. He's a neurosurgeon, and he's been doing some wonderful, wonderful work with fibromyalgia. And he published a paper, and at the end of all published papers, if you look, they all say the same thing, but, because of this and this, it needs further research. Dr. Heffes ends his with, fibromyalgia is absolutely an upper cervical spinal stenosis. That's it. Nothing more. He's the neurosurgeon. He's a wonderful man. He called me, and we spoke on the phone for about half an hour here last year. He's a neat guy. He's doing a wonderful work. He's got his neck way out there in the medical profession. Anytime you got something new like this, there's a lot of people shooting at you. Hypochondriacs. You considered hypochondriacs in the past. As we mentioned earlier, some of the people were institutionalized. Best stats we have right now is 4% of the women, 1.5% of the men. Everybody asks me why. Why is your office full of women? And I think it's just because women aren't warriors. We're the warriors. We're the defenders. We're made to be the guy that stands behind the plow and is jerked around and knocked down, and women just weren't made for it. I mean, the bottom line is, and this is nothing feminist whatsoever, because I like feminine women. It's just that when you look at the x-rays, you've got this little tiny spine here, you got this big spine over here. They're just not strong as we are. And that's not a bad thing, it's a good thing. We don't want to be the same. It's nice that we're different. I like the fact that we're different. But you can't take a woman and have her go through the same car accidents, the same horseback riding accidents, same snow skiing accidents, the same water skiing accidents, the same motorcycle accidents, and have her come out as healthy as a man. It's just not going to happen because they're not made for it. I'm sorry about that, because they have just as much fun as we have doing those things, and it's kind of sad. But the reality of it is when you beat a woman up, she's not as strong as a man. And those kind of sports really are rough in car accidents and so forth. I think that's why we have such a difference between the two of them. The other thing is just a miscellaneous thought. One of the things that fibromyalgia does that other diseases don't is they take away your ability to fight. And that's the really hard thing, because if your foot really hurts, you go, oh man, my foot hurts today. And you walk on it and you deal with it and you put up with it. And but when you have fibromyalgia, it takes away your sleep, it takes away your strength, it takes away your emotions, everything. And so you don't fight as well. So you get this kind of beat up look oftentimes. You can sit in a room, and those of you who have fibromyalgia, you can go into a room where there's 50 people, look around the room, and you can look at the eyes, and you can see the eyes that don't smile. You know, the mouth smiles, but the eyes don't smile. The eyes are tired, and you can tell a fibromyalgia patient because it really takes away your ability to fight, and it beats you up a little bit, a lot. Some of the symptoms of fibromyalgia, I'm going to go through these quickly, and then we're going to talk about why we have these symptoms. One of the things I want to leave you with this morning is I want to leave you with why you feel like you do and why that's okay. It's okay, so you understand it. I'm not saying it's okay you're sick, but I'm just saying why you understand that, and mentally why this is not you. I want you to separate yourself today from the fact that this is fibromyalgia and this is you, and we'll talk about that. Insomnia, fatigue, depression, irritability, nervousness, anxiety, mild to severe body pain, headaches, difficulty with breathing, irritable bowels, panic attacks, trigeminal neuralgia, calcium deposits under your skin, rashes, communication problems, rectal spasms, about 1/3 of my patients. So if you're having that, you know, don't let it scare you. That's part of fibromyalgia. Haven't seen that in the literature. Vaginal pain. If it's severe, it goes down into the low back and hip pain. By the time my patients have low back and hip pain, they're usually real sick. These are sick people. If it's running down your legs, you're real sick. You're probably starting to limp and close to a walker. Forgetful, foggy-minded. Other things that pop up with fibromyalgia. Interstitial cystitis. I've been diagnosed with that. I see it often. Almost never saw that commonly in practice. With fibromyalgia, I see it almost every day. I've never had a group of patients with interstitial cystitis, without lupus, without rheumatoid arthritis. These things are all tied in. We know that these things, interstitial cystitis I haven't really heard so much about, but I see it all the time. Lupus and RA, we know that rheumatoid arthritis and lupus are associated somehow with fibromyalgia. I have some theories on that. You know, it's in my book. I won't take time to belabor that this morning, but it's in my book, and we talk about that also. And here's why. Here's why all those symptoms. With fibromyalgia, what happens is there's a constriction in the upper neck, and this constriction pulls on the meninges. It's actually a constriction on the spinal cord structures. It doesn't hit up against the spinal cord. This is what I thought originally when I started researching this, but it doesn't hit up against the spinal cord, but it actually pulls on the meninges itself. The meninges is a bag that covers your brain and your spinal cord, and all of the cranial nerves and all of your spinal nerves, your autonomic nerves, you know, all of the nerves that run your body, from the involuntary nervous system to your regular peripheral nerves, all have to go through the meninges. When you pull on the meninges, it can pull on these nerves. When you pull on those nerves, they fire. You ever hit your crazy bone and you feel it down in your finger? Well, guess what? Nothing really happened here. There's nothing happened to your finger. It just went from here to your brain. Your brain registered that something happened to your finger, so you felt it in your finger. But nothing at all happened in your finger, other than the fact maybe some impulses were sent that way to make your hand jump or something. Well, this is the same thing with fibromyalgia. They're all phantom pains. It goes from the spinal level or from the cranial level right to your brain, and it registers as a problem that's not there. Now, the other thing that happens, that is a real problem, is it sends impulses the other way out to the muscles in your body and makes them tighten up. Most of the impulses that come off the spinal nerves that go this way are going to muscles that tell them to tighten up. At the lower levels, it goes to all your organs and tells your organs what to do also. So you have to understand that your organs are going to malfunction because they're getting impulses that aren't being sent also. You guys probably already figured out that part. And then if you leave the muscles tight long enough, they develop a lot of toxins. You just tighten your arm up like this and you hold it there. It doesn't hurt much right now, but in about 3 minutes, you're going to be crying. Well, maybe fibro doesn't tighten up that hard, but in many cases it does. But the toxins that build up and everything, it starts building fibrous tissue in these muscles that slide. And so it pulls on them. And that's why you get the fibro part of the fibromyalgia. So if you've got these nerves all sending impulses to the brain, and it's also sending impulses the other way, one of the things it does, and this is really huge, is it affects the sympathetic nervous system. It causes the sympathetic nervous system to fire unchecked. The sympathetic nervous system is the involuntary part of your nervous system that allows you to fight and run whenever there's danger. So now you're ready to fight. You're ready to run. You're wound up. You're wired. But then at night, you can't go to sleep because you're wound up and you're wired. And you're all the time waiting for the shoe to drop. What's happening? Who's coming in the door? Because you feel like something bad's about to happen. So even though you're pumped and you're wound up, after a very short period of time of not sleeping, you're exhausted. You're pumped. And one of my patients called it the wired tired syndrome. She says, I'm wired all the time, but I'm so tired. And so you're exhausted, but you're still being cranked all the time. So you have this anxious feeling. You know, somebody comes up behind you in the dark and scares you, you go through the roof. And that's because of this whole process of the sympathetic nervous system running. Now, the opposite side of the sympathetic nervous system is the parasympathetic. The parasympathetic digests your food, puts some water in your mouth, you know, and many other things, but it takes the blood from the muscles and puts it in here so you can relax and you digest this nice meal, have a good time. Well, when the sympathetic's on, that is off. Now you don't have digestion. So you have irritable bowel syndrome because your sympathetic is running. And almost every fibromyalgia patient I see has problems with the bowels, and this is why. Okay? Sympathetic nervous system running unchecked all the time. It absolutely fries you, it wears you out. And then it creates something new that my psychiatrist friend that's come in was working on. It's called the adrenal toxic syndrome. We really haven't talked about this before. But the adrenal toxic syndrome is a whole thing that he's been studying on his own, and now we're pulling our information and pooling it together with fibromyalgia patients, and it's this buildup of adrenaline in your body. And what happens, and this is new information, is the sympathetic nervous system makes you anxious. Anxiety creates the pumping of the adrenalines and more adrenaline, right? The adrenaline create negative, hopeless kind of thoughts in your mind. So you start running these negative, you know, tapes, if you will, in your brain. Those negative thoughts make you secrete more adrenaline and make the sympathetic nervous system pump even harder. So you've got this cycle running all the time. The adrenaline gets higher, you got more sympathetics, you're thinking these bad thoughts in your mind that just, in these hopeless kind of self-punishing type thoughts. And for people who have this bad enough, oftentimes they will do things to hurt themselves to stop this cycle. This is why some of the people cut themselves. They're not cutting themselves because they like to cut themselves. They're cutting themselves because they're out of control. They often even hear voices. Some of my patients say they hear voices and things. This is part of that whole syndrome. As the adrenaline and the sympathetics and everything come up, it can get pretty out of control, and it can wear you out. I mean, absolutely wear you out. So we're working on some procedures and medications and other things to stop this when patients come in the door. And anyway, Dr. I shouldn't mention his name yet, but he's joining us in January. So we're happy about that. This is part of why you feel like you do. So now, and if you'll go to PubMed, that's Published Medical Papers, PubMed.com, I believe that's .com, PubMed at least, and type in fibromyalgia, and then type in things like gastroenterology, or you can type in endocrine system, or whatever you want to take a look at. And you're going to find, for example, that there's a lot of doctors who have done research on the endocrine system, endocrinologists, and they have found that your pituitary doesn't work right when you have fibromyalgia. But they've also found that your female hormones are off, and your adrenal glands are off, and your thyroid gland is off. Guess what? It's kind of all off. But if you want to research the body, because of this massive amounts of impulses, you're going to find that everything is off. You don't see right. You don't hear right. You feel like there's a veil between you and the world all the time. When you have fibromyalgia, but they test your eyes and say, well, your eyes are fine, just like they were before, but it doesn't feel right because you don't see things correctly. You don't feel things. Your sensations are off. Your hormones are off. In many cases, we'll send people over to OBGYN in town, and maybe in their second month or so, if they're having some difficulties, and have their hormones checked. And he called me after a while, and he says, Paul, he said, everybody you send me, he said, these women don't have any testosterone. That's amazing, isn't it? You ever feel like maybe you don't have any testosterone? Your sex drive becomes absolutely nothing when fibromyalgia. And one of the reasons is because your testosterone has hit all-time lows. This is not you, ladies. You're not going crazy. It has nothing to do with that. It's just the facts of what happens with fibromyalgia. So when you feel like you're about to lose your mind because of the adrenaline and the sympathetic nervous system and because your hormones are off, the rest of your hormones, female hormones, are off also in most cases, it's not you. And this is what I was telling you earlier. I want you to get out of this. If nothing else today, I want you to understand this is not you. This is not you. It's okay. You are still there. The same you that was you before is still there. This is not you. This is called fibromyalgia. This is what's being done to you. The anxiety is not you. The craziness in the middle of the night when you haven't slept for days and you can't get to sleep and it's 4 in the morning and you're hallucinating, it's just fatigue. That happens to everybody that stays awake for long periods of time and doesn't sleep. Or you take drugs to sleep or medications, and I'm not against that at all. But still you don't get that rest of sleep. You wake up in the morning and feel like you didn't sleep at all. That's not you. You just didn't get any rest. And if you take anybody, you take the rest away from them, and you put them through the feelings you're going through, they're going to feel like you do. And it's not you. I don't want you to feel crazy. Okay? And I'm making a point of this because I have so many patients that come in and they're just almost hysterical in tears because they feel like they're losing their minds, and you know exactly what I'm talking about. And if it's bad enough, you get to the same point. And it's not you. Okay? This is fibromyalgia. So you're not crazy. You're just suffering. And I honestly believe that a huge percentage of the people in this country on antidepressants are not depressed. They have fibromyalgia at some level, whether it's severe or it's light enough that nobody's diagnosed it. And so we're running these numbers. We figure there's 9 million people in this country with fibromyalgia. 9 million. And I think it's a small number. I think it's a small number. I think that most of the cases are lighter and are undiagnosed, and they're the person you go to work with is a little fussy one day and nice the other day, and they look tired, and then they snap your head off, and they don't know they're sick. And they don't sleep well, and they cut it themselves. Just maybe have a light case of fibro. Don't judge them. Don't be rough on them. Maybe just go bring them some flowers or something. Sometimes it's easy for us to take somebody who's going through something and they just look grumpy, and we say, they're just grumpy. She's always like that. You know, don't do that. You don't know who you're dealing with and what. We have people come in. Sometimes they come in our office and they like eat us. They're tough on us. And you know what? Everybody in the office just loves them because we understand that sometimes people get to the point where they do that, and it's okay. A week or so, they're feeling better, and they come back and I'm so sorry, that means to be so rough on you. Okay, so this is fibromyalgia, and this is why you have all these strange feelings and you feel like you do. I can go on for a long, long time describing, chemical changes that create calcium deposits under your skin. Dr. St. Amon's did a wonderful job with his glyphosate and helping with that and with the muscle pain and so forth. There's a lot of people doing research everywhere right now, so there's going to be much more coming out of it. Some of the people say, well, I did this nutritional work and it made me feel better. Or I took hormones and it made me feel better. Yes, absolutely. If you do nutritional work and you do hormones, you're going to feel better because those two things are really suffering. You can't have constant diarrhea and get good nutrition at the same time. You need extra vitamins. You need extra help. You should be eating better things. And if you take hormones and they're out of balance, that's going to make you feel better. It won't fix the fibro, but it's going to make you feel better. Those are good things to do, and that's why. Massage, told you I was going to mention that. Massage makes you sick in almost every case. Very few people actually get massages successfully that have fibromyalgia unless it's been a long-term, slow process, because it puts you into flare-up. It's just too much. And so we think massage is an essential part of recovery because you've got to break that scar tissue out. We don't start it to the second month when most of the symptoms are gone. Most of our patients are 50% symptom-free by 4 weeks. That's where we start the massage. Then you can do your massage and you can have some really good results from the massage. Okay? Even then, it's a little bit touchy, but I like to start it while you're in the office. That way I can be there if there is a problem. And we have some massage therapists. They start easy, and the next time a little harder, and pretty soon they're breaking up that scar tissue, and you're sore for a couple days afterwards, and next thing you know, you're moving those muscles, they don't hurt anymore. I mean, it really goes away. That muscle pain just disappears. Some of the causes for fibromyalgia, I'll just mention these briefly. You guys probably know these as well as I do. Physical trauma, surgery. Surgery is something that I've been working on for a long time, and I've been talking about. I even noticed on some other websites it's popping up now, which is really neat. Surgery is a cause of fibromyalgia. I'm absolutely positively sure of it. I don't have any really good data, although we've been keeping data for over a year on it, and we're going to publish that data soon. I think we have about 100 people in our research that's going to be published. I really haven't counted, but I believe that's pretty close. We're going to publish that at the end of the year. And we've collected a lot of data about surgery in patients who have, it's just information from the patients, but we consistently see fibromyalgia being started with surgery or made significantly worse. If you have fibromyalgia and you have a surgery, chances are you're going to get a lot worse after the surgery. Yeah, really bad. I've got a lady here in Texas, not here in Texas, but in Texas, and she had a hysterectomy. She's a school teacher. She came out of hysterectomy screaming in pain, and they loaded her up with morphine until they finally got her to stop screaming. She left her on the morphine. After that, she taught from her wheelchair for 2.5 years, and then she came to see me, and she's totally 100% well today. She's doing great in Texas. But it was the surgery, and there's a lot of work which we've got some contacts we're working with in that arena right now. We're trying to figure out how to reach the anesthesiologists and so forth, and I've even got some ideas for some devices that you can use during surgery, things to support the neck properly, because I think they're actually pushing it out inadvertently without any intention. These are nice people. We can't collectively say all those MDs are all a bunch of bums. It's just not true. They're nice people. Most of them went to school for the same reason I did. They want to get people well. They want to help people get them well. They're really trying, and some of them are just jerks too. I'm sorry. My profession too. It's just the way it goes, you know. It's just part of life. You know, if you go to attorneys, some of them are great guys and some of them are jerks. You go to your mechanics, some of them are great guys. Just because you become a professional doesn't mean you're nice, you know. So you guys are going to run into those guys too. We had a guy at our local hospital. Shouldn't have said that on tape, huh? We had a guy at our hospital. One of our patients, before she came to see me, she went over to the hospital, and this guy, and she's got her arm curled up on her chest. She's walking on one toe. She's crying hysterically, and she's telling him she has fibromyalgia, and she's looking for some help at the emergency room. And he asked her, he says, well, where are you from, honey? And she says, I'm from Oklahoma. And he says, well, why don't you pack up your stuff and just go back to Oklahoma? He says, we don't want you out here. We don't like drug addicts. I'm not going to help you. And he continued, she said, for about 10 minutes, just belittling her, what a horrible person she was and how she should leave and go back to Oklahoma. Now, that's the jerk side of it. Yeah. And so hopefully you don't have that experience very often. I don't think you will. I think most doctors are pretty good guys. Mental stress. I don't really understand this so much, and I'm not quite sure this is totally true, but I know that one thing for sure is that stress makes fibromyalgia worse. But I've had a number of patients that came in that couldn't find any etiology, nothing that caused fibromyalgia other than the fact that they went through the death of their parent or their child or a spouse or something. There's heavy stress. Maybe it's because they're so tight. I don't know. But it seems to be a cause. Whiplash, we know that. I think there's genetic predispositions. I can't prove this either, but I see it too often. I see the mom with her little boy come in when they both have fibro. You know, 2, 3 sisters that all have fibro together. You know, a genetic predisposition. I really think that that's true. Why would 3 sisters all have fibromyalgia? Nice to have you guys here this morning. It's nice when you can console each other, I'm sure. But those are some of the things, and I'm sure we're going to find more as time goes on. One of the sad things I find about fibromyalgia is that fibromyalgia oftentimes is hidden. And so it's hidden in diagnosis other things. For example, I think one of the biggest misdiagnoses of fibromyalgia is you're an alcoholic. I think that is, and I think that many of the people who are alcoholics are fibromyalgia patients, and the only time they feel better is when they drink. So they drink. This is probably predominantly true among men because we're just cool and we're not going to the doctor and we're not going to do anything, so we come home and we drink. We feel better if we drink. I didn't drink when I had fibromyalgia because I heard it was bad for you and made you sicker, so I didn't do it. But probably do it now. I felt so bad, you know. And I think that they get diagnosed as alcoholics when indeed they're not. And then they have to go through this process and this humiliation of trying to get off of alcohol. And now they have to fight for every day to stay off because they're miserable. Now, I'm not saying it's true of every alcoholic. I don't believe that's true. But I think in a lot of cases it is true. I think that oftentimes people will self-medicate with drugs. They buy it from their buddy down the street who just happens to have drugs, and they take it because they feel better. Or they don't do that at all. They go to the medical doctor and they get the same drugs. It's the same drugs, so wherever you take it at GMD, you take it down the street, you're still taking the same thing, except you get more honor when you take it from the MD, and you get the diagnosis of fibromyalgia, which I think everybody should do. I don't think you should be taking them off the street. But still, I think that there's a misdiagnosis here, and I think that the legs of this, that the roots of this are going to go into many other diseases that we really haven't really looked at carefully. And I think we're going to find that many other types of problems, for instance, I see quite a few cases of trigeminal neuralgia with this horrible shooting pain and burning pain into the face. I had one lady had her teeth pulled on half of her head because she thought it was her teeth, and she got worse instead of better. Trigeminal neuralgia. I see that fairly commonly in the office, and it disappears with treatment. Obsessive compulsive disorders. This is a whole new thing. We're seeing lots of patients with obsessive compulsive disorder. Guess what? When I treat it, it just goes away. I think this is tied in with that adrenal toxic syndrome, because you get so up here that you start trying to have control of something out here. One of my staff members used to stack her papers. You know, everything had to be stacked perfectly all over the house. One of my patients from Canada, from Reno, I'm sorry, he had to count all the ceiling tiles. He had to count all the dots on the road as he drove. It became kind of a problem driving. He knew all the spirals on every spiral notebook. He had to count everything. He's always had to count, and it just stopped once everything calmed back down again. And then the things that it's easy to understand is like your brachial neuropathies, you know, the pains into your arms and pains into your legs and all those kind of pains. It's easy because we know of the pulling of the meninges and how that could actually mimic other types of problems. And one of the problems with fibromyalgia is that it mimics so many different things that you'll end up having surgery somewhere. I had a lady come in 2 weeks ago now. She's on a polio crutch, been like that for years, just on one side. She's got a brace on her ankle, and I asked her why, and she's limping horribly, and she says, the pain in my leg is so severe I can't stand it. And she said, and I had an accident and I hurt my ankle and have such bad arthritis in my ankle that I have to wear this brace and I have to walk with this polio crutch. And when she got to the office, she was crying and she couldn't fill her paperwork out because she couldn't think. You guys can understand that. And sometimes it gets bad enough, people they can barely walk, much less think, and that's what we help them with the paperwork. And I brought her in and I tested her, and with the new tester we're going to be doing later today. And the pain in her leg and foot disappeared during the test. And she took her polio crutch and she got up without it, and she walked around. She said, my pain's gone. I have no more pain in my leg. I have no more pain. So I thought I had arthritis in my ankle. It's all gone. And she tossed it. She hasn't used it since. That was it. Got rid of her crutch, and she's been walking around and laughing and smiling. And she's been progressing real well with her treatment. But this is something. We had a lady that came in 2 days ago, Thursday. On Thursday, this is Saturday, yeah. And Christy in the office came into the office and said, I need to talk to the doctor. She says, I got somebody on the phone, I think she's going to commit suicide. And she said, and so I came out and talked to her on the phone and I said, look, honey, he said, you got to come down here right now. And so anyway, we worked with her family and got her son to drive her. It was a couple-hour drive, and she came in. And yesterday when I left, she was walking around the office laughing. It was just left, all this horrible stuff, and somebody had tried to do something to her atlas and had set it all off, and she was just losing her mind. And she's laughing and hugging everybody in the office. Now she's like, you know, she's like their little trophy, you know, in a way, because they're so happy because the whole office participates. My office isn't like you come in for an appointment and you leave. You come into my office and you sit with 15 people that already had their treatment that don't want to leave because they're talking with everybody. It's group therapy. They don't realize it's group therapy, but it's group therapy. They sit out in the waiting room, they share their experiences and their hearts and their lives, and in the second month they're out shopping and hiking and doing things, and then the ones that have been there are taking care of the young ones, and so they all just gathered around her and threw their arms around her. One girl says, come sleep at my house tonight, you know, I'll look after you, and it's like that. I mean, it's pretty neat. But this is the kind of things that we see with fibromyalgia, and also the things that it can mimic. Are you with me? It mimics the fact you lost your mind. It mimics the fact you have sciatica. So when we treat people, we don't go into looking at everything, because you could spend a year and $100,000 testing everything. So we treat the causes of fibromyalgia. We treat the cause of that. And as that disappears, then if there's something left over, we take a look and go, okay, what is this? Unless there's something real serious in the beginning, we have to look at. And so that's the way we handle it. And most of these things just disappear because it mimics things. That's why it's so dangerous to have surgery, because you can have a small low back pain, and with fibromyalgia, it's a 10 instead of a 2. You might have a little arthritis that feels like you have a blown disc. You might have a low back pain and pain shooting down your leg that has nothing to do at all with a blown disc, and still end up with a surgery. And you guys have probably already had some of that here. So that's one of the problems with fibromyalgia. It mimics so many other diseases, and I don't know how deep those roots are going to go, but they're going a lot deeper than I thought, into areas like trigeminal neuralgia, into obsessive-compulsive disorders, into probably alcoholism and some other things. A light case of fibromyalgia, like we mentioned earlier, is just somebody who's got all of that, but just a little bit. It's not as bad. And when you have a little bit, it still makes your life miserable, so you become kind of a miserable, grumpy person. And so people don't look at you as a sick person. Now they just look at you as a miserable, grumpy person. You're actually almost better off if you got a little bit worse. At least you get, at least you're sick enough you know you're sick. The other way, you don't know you're sick. You just think you're a miserable person. Fibromyalgia in children. This is one of my pet things because I've seen this so much. And some of you may have had. Does anybody here have fibromyalgia as a child until today? Has it gone that far? That's good. I see quite a few of those. And it looks like this. Okay, just picture yourself for a second. Now, fibromyalgia can hit at any age. It doesn't make any difference. I had a 10-year-old girl not too long ago. She'd thrown off her horse and landed on her head. Cried in her mother's lap for 18 months before she finally got to the office. But this child is tired in the morning. They don't want to get up and go to school. They say their stomach hurts, but nobody believes them. When they do go to school, they're tired. They're foggy-minded. They don't do well in school. And after school, they certainly don't want to go participate in sports because that's just way too hard. So now they're lazy, too. They see themselves that way. They come home, and it's time to do homework. They're miserable. They don't want to study. They can't study well. They can't think clearly. They would rather sit in their room and play video games. Anything but have to participate at any level. At nighttime, when it's time for them to go to sleep, they don't want to go to sleep because they can't go to sleep. You with me? This sounds like you guys. But when a kid does it, this kid is now, because they don't do these things and they don't participate, and they get a little bit of joy out of eating, they probably eat a little bit too much. Now they get fat. So now we have a fat, lazy kid who's not too bright. That's the way they get perceived. That's the way they perceive themselves. And now they grow up with this perception of themselves and that self-image. It's very destructive. So as a child, and this child doesn't know they're sick because maybe they've always been sick. I just treated a boy who got hurt at birth. And he got well. He'd never even know what it felt like to be normal. He's 27, I think he was. Just went home to Texas, another Texan. So this is fibromyalgia as a child, and this is what happens. So oftentimes you see these kids that look a little slow and overweight, and they just have fibromyalgia. They need to be checked out. I've got a kid just like that. And I treated him, and he went from a D and an F student to an A student in 1 year. This year I treated him. Next year, straight A student. He's off in college right now. Yeah, he was losing time. He'd be one place, 45 minutes later, he was somewhere else. Didn't even know how he got there. Very poor recollection of his childhood, even now. One-sided fibromyalgia. It can pull on one side, and you can get fibromyalgia on half your body. Anybody here have that? This is unusual. I don't see it very often. I've seen, I think, 6 or 7 cases. Fortunately, all of those cases I've seen have gotten well. I'm not quite sure if that's an easier case or it's just the way the cards fell, because I haven't seen that many of them, but I've seen it. No symptoms, but on half the body, just like that. My first patient like that was a casino manager's wife, and she came in, and she's just a beautiful girl, a couple of little kids, and she put herself to sleep every day with sleeping pills, antidepressants, pain pills, wine, and snuff. And when she got all that together, she could get to sleep. I was weird. And the first week her pain went away. It was when I was my first started working with fibromyalgia. You can imagine, now that you understand what all this is and where it's coming from and what it looks like, you can imagine what it must be like to have a relationship with somebody under these circumstances. First of all, if you're the person that's got it, you feel embarrassed, you feel guilty, you feel, horrible feelings about the fact that you can't be the person you want to be. And if you're the other spouse, you're married to a person that's skin's too sensitive to touch. It hurts if you touch them. Their sex drive is zero. They're grumpy and tired and sleeping all the time, and they don't want to go places with you anymore. It's hard. It's hard on everybody. And so if you've got somebody who loves you and stays with you, they deserve an award too, because it's really difficult. And sometimes it's unbearable. Some men I know, I've got this one patient, and her husband spends about 9 months on the road each year because it's hard for him to deal with all that. But he's got her in the office, and he's loving her, and he's trying to encourage her. But it's a difficult situation. So everybody needs to be aware of why. So if you've got a spouse that's dealing with this, hopefully we'll have this talk on the video here the next few weeks. It's kind of a lot of work. It takes a little bit for our video guy to get them up, and have them watch it, and so they understand. Because if they don't understand, and you can't tell them, because they're not going to stand there if you tell them, because you're crazy. I'm kidding. The techniques we use for this are essentially painless. Sometimes if you have a lot of arthritis, there's a certain amount of discomfort, but it's not bad, and it's just for a second. The goal is, of course, to relieve the stenosis in the upper neck. The treatment time is essentially 8 to 10 weeks. I do not set that. So if you come to my office, you can ask me how long it's going to take you to get well. I don't know. I really don't know. It kind of works like this. When you get to the point where you're 90 to 100% symptom-free, you've got 2 weeks left. That's the way it works. That almost always falls in that 8 to 10 mark. Almost always. It's rare for a patient to go home in under 8 weeks. It's rare for them to stay longer than 10. Unless there's some kind of complicating issues, they almost never stay longer than 10. And every once in a while, you just get some of these necks that are so tight and nasty and arthritic. You can't go too fast. You got to go a little slower. You can't hurt the patient. They take longer. But other than that, it almost always falls inside that slot. Patients always ask me if I'm going to take them off their medications. The answer to this is no. We don't like to change anything when you come into our office, number one. If you come into the office, I don't want to change anything other than the fact that you're seeing me. That way, whatever happens, I know I did it. So if you come in and we start an exercise program or a nutrition program, we put you on hormones, it confuses me. So we normally don't change anything whatsoever. We are thinking about using something to help knock some of the adrenaline down, with our new doctor in January. But we probably might even push that out a little bit, because I need to know what's happening clearly with what I'm doing. So I don't take you off your meds, and I wouldn't anyway, because I think it's really important for you to work with your doctor that put you on the meds. I wouldn't interfere with his treatment. I would ask him not to interfere with my treatment and respect it in the same way. The doctor who's coming in, one of his jobs is he's not going to take over your meds. What he's going to do is work with your doctor at home, call him on the phone, say, look, this is what we're doing, this is what's happening, this is some of my recommendations. And so then, as the symptoms go away, then we cut back on the meds. So if you're 50% symptom-free, you should also be 50% off your medications. And you'd be absolutely shocked at how easy it is to get off the medications as the pain goes away. OxyContin, methadone, a lot of these people they have such a hard time getting off of. If you lose half of the pain, you can cut those back and you don't even notice it. So you get the last 25%, you're going to notice that. It's tough. Your body doesn't want to let go of that last bit. But the other goes pretty quickly. It's not that hard. You can get rid of most of them. Usually about 6 weeks into treatment. Usually 2/3 off your meds, maybe 3/4, typically. And then sometimes you have to go home and kind of wean off the other. But the main thing is make sure you talk to your own doctor, and we don't want to step on anybody's toes and overstep our boundaries either. I think that's important to work with whoever is managing that. What can you expect during treatment? I think probably one of the things you can expect for the first couple of weeks is a little displaced because you're away from your little nest and stuff, and you're there. But it seems like it only takes a few days before you start making friends, and the people there are so friendly because they're all going through the same thing you are, and they're all, they're all very upbeat. When things start changing, everybody gets really excited. Sometimes a little too excited. My waiting room gets pretty noisy sometimes. We got a piano out there, and sometimes they're playing piano and singing songs. So when the new people come in, they're sick. Everybody realizes, so everything gets quiet, and the lights are always dim, and that type of thing. But from the treatment, I always say to give it about 3 weeks. We're finding more than anything that people are normally responding in the first week or two. They're feeling significantly better in the first week or two. Sometimes it takes longer. I had a lady from Texas, pastor's wife, and 5 weeks into treatment, she hadn't shown any results at all. At 4 weeks, I was getting ready to send her home, and she came in and told me she's staying for another 4, and I was a little bit shocked. And 5 weeks, like in one day, 85% of the symptoms disappear. She went home symptom-free, and she's still doing well. And so once in a while we get those. Those confuse me because it makes it a lot easier if I knew that it only takes 2 weeks to figure out whether it works or not. But that confuses me sometimes. It makes it more difficult to decide when to pull a plug. But usually most of the patients the first couple of weeks are feeling better. They're already starting to cut back on their meds. Their anxiety levels are down, and most people really don't sleep well till about the 5th week, although I have patients this week that just started. They're already sleeping well, which kind of confused me. So you just don't know. Sometimes I don't understand exactly either. Sometimes the pain goes away first. Sometimes the anxiety goes away first. Usually the lower stuff disappears first. Usually that horrible hip pain and the limping and everything, that usually disappears in the first week or two, typically. Second month is, these are my moms. I call them my moms. They're the ones that kind of mother the new people and take care of them, and they're taking them shopping, and they start going on hikes and things. It's real pretty up there. Usually you're starting to feel good enough that you're taking a position more of nurturing and helping other people. I don't really promote that in the office at all. It just kind of happens. It's kind of a natural process. I think you guys are all, women are all moms, take care of somebody, if they feel good. And probably one of the most difficult things is going home. We just sent one of my really dear, sweet patients home. She's here from the East Coast. And, everybody's in tears. Everybody's crying and everything. It's hard for them to go home because it's almost like this is their new home. And we've had numerous patients just move there. They just picked up and moved to Tahoe. And it's a nice place to live. I think it gives them a certain amount of security being around the office there, too. But it's a little bit difficult. And some of the difficulties about going home are this. Now you're well. What are you going to do with it? What if you've been sick for 30 years? What are you going to do with being well? It's like, now what do I do? And so you have to redo your life. And so my recommendations on that would be, is do some fun things. Don't go home and let somebody throw you into a job and push you too hard, or now you're well, you're going to go to work. And so I always send everybody home with the recommendation is to take the time it takes you to readjust mentally to being well, because it's an adjustment. It's not an easy thing to be well. And so it's fun and it's great. You're having a good time, but at the same time, you need to work into things gently. So I say the first 6 months, I don't want you doing anything. Anything you don't feel like doing. Especially don't want you vacuuming and lifting things and doing things that might interfere with what we did. And after that, kind of work into things. Some people go right home and go back to work. They seem like they do okay. But some people just mentally aren't up for it. They're not ready to go back to work. They're not ready to deal with stress or a mean husband. We've had a few of those too. So just take it a little bit of time. Go home and redecorate your house. You're probably going to find that the colors don't match you anymore, and maybe the tin foil on the windows needs to come down. Some of that stuff. Oh, shoot. So I don't know, go dancing, go out and stay up late because you feel like it instead of you can't go to sleep. Have some friends over and enjoy it. Do some of those things. I am so thrilled about the opportunities to come here and speak, and we're trying to go to at least one town each month and speak, and we're hoping in the next couple of months we're going to up that to going to 2 different places, and we're getting as much as we can on the internet. We're meeting with some other associations and giving presentations and trying to get the word out as fast as we can, and working on some research projects, clinical kind of stuff. But anyway, it's a big job for me. I ask that you pray for me. It's important to me. I believe that helps, and I'll keep doing the best I can. Pray that I keep my strength up. We work awfully hard at the office and some long hours, and so does he. I appreciate him a lot. We're going to be doing some testing right now, and I'm going to make a little disclaimer. I've never had a problem. I've never had even a little problem with this, but that there's always a risk that if I test you, that it could aggravate it and get a little worse afterward. Never had a complaint. I don't know that anybody ever did. I just want to mention that so you're fully aware of it. About 80% of the time, we can test you and tell whether or not you have fibromyalgia, and also tell about how you'll do a treatment. I mean, if I test you and the symptoms get a lot better, then we know you should also respond to treatment. At least the patients that do that normally do. We've only had one that didn't. And I think that's just about it. What I'd ask, though, is that if there's a couple people that are on their way to make a plane flight, I think Frank had mentioned that ahead of time. If I could test the people who have to catch a plane or be out of town quickly, and because a lot of people drove in or flew in, and after that, I want to see the sickest people, the ones of you, and you know that because you're the one sitting there going, I love this information, but I'm dying. I got to get out of here. Okay, that's you, and I want to see you first so you can leave and go home and do whatever you need to do. Okay, and that's it.